wikidentist.com.
Orthodontic treatment is a very effective way to correct all your dental malocclusions. That is actually improperly placed teeth, you have spacing between teeth, if you have crowded teeth, if you have forwardly placed teeth, all these things can be corrected with orthodontics. But most of the time orthodontics treatments is a longer procedure. It might take 18 months to 24 months or even more. So sometimes you, because of your pressures, your life pressures, your office pressures, your family pressures, all these things, you might not be able to complete the treatment. So what happens if you do stop it in the middle, or is it possible to stop the treatment in the middle and then continue later? Is it possible to just leave it just like that? That's what we are going to do today. We are going to discuss on that. I am Dr. Thomas Nechupadam from Nechupadam Dental, who is an orthodontist for the past 15 years. We have seen a lot of cases which has become complicated just because they left the treatment in the mid. So, so please make sure that you continue the process until you finish, unless it is very required. So what happens if you stop it in the middle? So what happens during the procedure of orthodontic treatment is actually the teeth moves through the bone, and the teeth has something called as an elastic band around the teeth, and then it is fixed onto the bone. That is why it is moving through the bone. Now since I told that it is elastic, see, if it can come this way, it can go back also, because all the elastics, when the pressure is removed, then it can go back. So it is just like an elastic. If you pull it too much, as soon as you pull, it can go even worse than that. So what happens is, even the teeth are like that, so it can actually go back from worse to a worse position. So make sure that if at all possible, make it a priority that you have to finish the treatment and get it into retainers. If you are not able to do it, make sure that you retain at that position and then continue the treatment at a later stage by using the retainer at that position. Otherwise what happens is, see, some cases if you stop it in the middle, what happens is your teeth will go to an unwanted position which was not there even before, and also your bite will not be proper. See, if it is an extraction case, especially when you have to take out teeth so that you can move the teeth, what happens is that the back teeth can move into this position, and then what happens is, if you move the back teeth into that extraction space, what happens is there will be a lot of food getting in between all these back teeth, and then if you have food getting in between, you might be able to brush it and keep it clean for some time, you might be able to floss it for some time. If at all you don't do it, it can get into a caries, and then you can get into pain, and then you will have to lose the tooth and even cause even gingival issues or periodontal issues because of that. So please make sure that that is not happening. So second thing is, if you have if you have started the treatment and suddenly if you have extracted some teeth and then suddenly you had to drop it, make sure that you replace the tooth there and then stop the treatment. That is also possible. Otherwise what happens is, all these teeth will drift into that position, and during the orthodontic treatment there is another problem, where that is, the teeth may not be in full occlusion, or it may be in some eccentric position. That might cause periodontal issues other than all these normal periodontal issues like trauma from occlusion can occur. So it is always better not to stop orthodontic treatment in between. If you are not able to continue the orthodontic treatment in the normal braces treatment, then you can shift on to an aligner treatment and then go ahead, or if you have removed some teeth, you can replace it. If you have some space between the teeth, you have to do that, or even at least do a retainer before you stop the treatment. If you are stopping it for a marriage function or something like that, make sure that you go back and restart the treatment in 1 month's time, so that you can continue the treatment and finish off the treatment in the due course. So all these things has to be done. It should not be kept as though, okay, it has moved to some extent, I can remove it. Some of the patients have come, they removed the orthodontic appliance by themselves, because they didn't have they thought that the teeth has already moved. If I go to X dentist, then it will be costly for them. They removed themselves. But what happened after some time is that it became worse than what they started with. So All these things is because the teeth has rebounds back to abnormal position. So please don't make it happen. Please make sure that you follow up all your orthodontic treatment until the doctor says that it is perfectly fine. Orthodontist will make sure that you have a proper attention so that you will get it treated, and make sure that you retain the teeth until the doctor says okay, it is okay to not to use any retainers. But even after that, make sure that you go do a follow up so that you will see he will make sure that the teeth are in good position, because it is his work, it is his duty, and it is his pleasure to make sure that the teeth are in good position, so that you also will smile better, and he also will be very happy to see his work really doing well in your mouth. So thank you very much for watching. Make sure that you continue the treatment. If you are not able to continue the treatment, please make sure that you follow all these rules so that you will not get into trouble. Make sure, if it is possible, prioritize orthodontic treatment and get the treatment done. If it is not possible, if you are traveling to a place abroad, if you are traveling to a distant place, you should make sure that you take a written consent from the orthodontic doctor, and then go to the orthodontist so that they can see what exactly has been done and then follow it up even in that place. So that is also possible. So make sure that you continue the treatment and get a good smile, and make sure that you make all these retainers and everything, so that you will have a great teeth and a healthy teeth rather than losing out teeth. Thank you very much. I am Dr. Thomas. For all your queries, please make sure that you give me on the comment box, or even you can contact me on WhatsApp, and you can clarify all your doubts on dentistry. Thank you very much.
Wikidentist.com